It is 8:49. Until recently, you know, the headlines about stem cell research and stem cell use derived from human embryos was very controversial. Well, now plastic surgeons are taking stem cells from your fat and using them for breast reconstruction. It's an amazing procedure that can make all the difference in the world for breast cancer patients. Joining us this morning here on the morning show, local plastic surgeons Dr. Louis Obey and Dr. John Murray, who received the first FDA-approved fat processing unit. Gentlemen, welcome to the show. Good to have you here.
Thank you.
Dr. Obey, let's start with you. What makes this procedure different from what we've seen in the past? Because fat grafting actually goes back something like 100 years.
That's true, Bruce. It's what makes it different is the processing of the fat. We actually, instead of injecting the raw fat, we process it where we can eliminate the elements which are not useful and actually condense the fat into a stem cell enhanced product, which has better stay-in power and also healing powers.
Now, we talked about the benefits for breast cancer patients. There'd been a lot of controversy about the use of implants and the implants rupturing, toxicity from them and things like that. This seems to be a viable alternative. How is this going to change the landscape for breast cancer patients?
Well, it gives the reconstructive surgeon and the respective patient a lot more options. First and foremost, we're using all of their own tissues. And we're doing that currently with autologous flaps, larger flaps from the back or the abdomen. But this actually is an outpatient procedure and using the same fat that we would otherwise discard with liposuction. Except now we're actually concentrating it, filtering it, otherwise not manipulating it, and then infiltrating it into the respective area.
Mm-hmm. So you said basically it's done on an outpatient basis. How long does the procedure take?
It takes 1 to 2 hours.
Which is a fairly quick amount of time.
It is.
Any recovery issues for the patients or things that they've got to be concerned about?
The recovery is fairly quick because it's non-surgical. They have a little bruising from the donor site and the breast, and we usually restrict activities for about 7 days, and then they can resume most activities.
Since this is a fairly new procedure here in the U.S., they've been doing it in South Korea for a while, I believe, right?
Yes, for about 8 to 10 years. Dr. Lee, and also in other parts of Asia and Europe, there's a stigma regarding stem cells, and what we're using is basically condensed fat with increased concentration of stem cells. We don't alter the stem cells, we don't change them, we don't culture them. It's all done within one treatment. It's a closed, sterile system. I think Palomar has the only system of its kind. It's totally enclosed and totally sterile.
Now, because it is fairly new, are insurance companies receptive to paying for the procedure?
Well, we're currently working with the insurance companies to improve that reimbursement, because a lot of the reimbursement we've had historically has been based on less complicated transfer procedures using fat. So I think as more experience grows, then the reimbursement shall also follow.
And Dr. Obey, reaction from the patients after they've undergone the procedure when they thought that they were going to have to get implants and weren't really happy about it?
We still are very early in the process, Bruce. We've only been doing this for 2 months, but based on other longer term studies, the response has been extraordinary.
All right.
And we don't have the inherent problems with implants or the invasive procedures of the autologous flaps. It's all done without surgery.
All right. Want to let you know that you probably want some more information about this. A little later this afternoon, we will get a link up to the good doctors on newsforjax.com in our health section, or seen on 4 on the morning show page, so you can go ahead and follow through if you want to find out more about this procedure. Gentlemen, thanks very much for being here.
Thank you.
Meantime, at 8:50.